Hello, back again with another episode of Real Health Talk with Dr. Coring. My name is Dr. Coring. For those who do not know me, I am a board certified internal medicine physician who's training now to become a hematologist and oncologist. And it is my passion to educate common folks such as yourself regarding health topics that affect everyday life, health topics to make you more well. And so that's what I like to do. And also, I like to educate patients because smarter patients, informed patients are just better patients. Okay. And so, the health topic I would like to discuss today is arthritis and specifically osteoarthritis. Okay. Osteoarthritis is actually the most common form of arthritis. And what stimulated my thoughts in this topic is this new study that just was published in the New England Journal of Medicine a couple of days ago, October 30th, 2024, basically suggesting and showing with the research that once weekly semaglutide, which is a GLP-1 receptor agonist, also known as Ozempic, is very helpful in actually reducing knee pain, osteoarthritic knee pain in patients who were obese. And so basically what they did in this study is they took hundreds of people and half the group, or not half, but a portion of the group were obese and took Ozempic, and another portion of the group were obese and didn't have Ozempic. But all groups had knee osteoarthritic pain. And so what they assessed was that the group that took the Ozempic who had obesity with the knee osteoarthritic pain actually had a reduction in their pain simply because they had a reduction in their weight. And so the weight loss because of the semaglutide actually helped the knee osteoarthritic pain. And so that's essentially what drove and also motivated this discussion. And so now I want to talk more about osteoarthritis. All right. So now we learned that basically being obese can cause osteoarthritic or osteoarthritic pain, knee pain specifically. All right. And so that's one of the major risk factors. But there are other risk factors for osteoarthritis. But first, before we go into the risk factors, let me actually allow you guys to understand the disease. What is it? Well, basically, it's breakdown of what? Breakdown of cartilage, joint tissue that's located between the bones, our long bones mainly, but there's joints and cartilage between all of our bones. It serves as cushion, okay? Why do we need cushion? Well, we need the cushion to help the bones move. We also need the cushion to help the joints function well. And we also need the cushion to reduce friction and bone degradation because of the friction. You see, if bones start touching each other, then the bones itself break down. And that can cause a reduce in minerals such as calcium. That also can cause a reduce in height and also cause deformities and pain and also fractures, okay? And so we want to prevent that. And how do we prevent that? Well, one of the preventions is weight loss. Hence, that's why the GLP-1 receptor agonist semaglutide actually help people with knee osteoarthritic pain, okay? So that's how knee osteoarthritis or any osteoarthritis form is breakdown of the cartilage, okay? And it's caused the joint tissue to break down. It's caused deterioration, and essentially that causes pain because the bones can have some friction, and we do not want that. And so what are the risk factors? Well, we talked about obesity. Being heavy weight is a risk factor for osteoarthritis, okay? Inactivity is another risk factor. Other risk factors, diabetes, smoking, foods, foods high in carbohydrates, high in sugars. These things are risk factors. Women in menopause is a risk factor. Sometimes it's genetics is a risk factor. It can run in the family, okay? Repeated stress is a risk factor, okay? Because it's the cortisol. It's the cortisol that can help break the joints down, okay? So stress is a major risk factor. And then when you couple the stress with obesity, it becomes even more risk factor. Then you start smoking because you're stressed, it becomes a more of a risk factor. So you see how it could compound. All right. And so how do you know what does osteoarthritis, how does that present? How does that look? How does that affect people? Well, it could cause pain. We talked about that. It could cause joint stiffness, okay? Tenderness of the joints. You could just touch the knee. And by the way, it's the knees, the hips, and the hands are the most common joints that are affected. Why? Because these are weight-bearing joints. We put a lot of weight on these joints, and that can cause a deterioration, okay? And so that's why moving these joints around can, allow the joints to essentially create movement, lubrication, and also activity, and reduce the stiffness. All right. And what are the treatments? Well, we talked about weight loss. That's the mainstay treatment, weight loss. And also, we should talk about other treatments like movement. Physical therapy is one of my favorite treatments as well. Moving helps. All right. Other medicinal treatments. I start with Tylenol. Osteoarthritis Tylenol works well. I don't like prescribing NSAIDs for this, like ibuprofen, Advil, or Aleve, because typically my patients with this disease are older patients, and also, at risk for kidney issues. And some people, they have had a GI ulcer or a gastric ulcer, and these medications, such as these NSAIDs products, ibuprofen, can cause ulcerations and bleeding. All right, and so and also it can increase the blood pressure. And so I like Tylenol. If the Tylenol is not doing it, then I prescribe a NSAID type topical gel or cream like diclofenac gel. It's a good example. I think there are some over-the-counter ibuprofen gel as well. And so we talked about weight loss, physical therapy, Tylenol, the gels, diclofenac gel, and then sometimes we do injections. It's not my favorite, but sometimes that's necessary, and we, refer to the rheumatology for that, or sports medicine physicians. They're really good at doing that. Okay, and so how can we prevent this? How can we prevent osteoarthritis? Again, let's lose the weight. Let's focus on the weight loss. That really is helpful. It works, okay? It can reduce the pain. The study proved it. They took the semaglutide, they lost the weight, and the knee pain improved. That's the start. Reduce the bad foods that we eat. More activity, walking is really, really helpful. Reduce the stress, okay? If you're diabetic, diabetes type 2, it's reversible, okay? Let's reverse the disease, all right? More vitamin D, more calcium. That's helpful. All right. And stop smoking. All right. So let's summarize. Osteoarthritis is very common in the world. People are really affected. It's caused by deteriorating the joints, especially the weight-bearing joints. Very, very common in the knees. One of the major risk factors for this disease is obesity, and therefore the mainstay treatment of this disease is weight loss, and the main prevention of this disease is weight loss. Okay? I love you guys. That's my time. If you have osteoarthritis, if you have knee pain, and if you can, try to lose the weight. Peace. Like and subscribe too. All right. Love you guys. Peace.